Come in.
Hi, Mr. Smith.
Yep.
Pleasure to meet you. I'm student Dr. Leonardo Zayas-Bazan. I'm here to perform a history and physical exam on behalf of Dr. Hill. Is that okay?
Yep.
Perfect. All right, so let's get started. So what brings you in today?
My left nail toe is in severe pain.
Your left nail toe. Okay, and can you tell me what happened?
I just randomly noticed it in the shower.
Okay, do you remember stubbing your toe, any trauma to the area?
No.
Okay, and when did the pain begin?
I can't say for certain, but honestly, it was probably around several weeks ago.
Okay, and do you mind if I touch you?
Yeah, go ahead.
So is it here where it hurts?
That's exactly the spot.
Okay, and how long does the pain last?
It's constant all-day pain.
And if you could describe the pain, is it sharp, dull, throbbing?
It's usually sharp pain, but it's dull pain when I'm just doing nothing.
Okay. Did you take anything to make it better?
I did. I took Tylenol, but it didn't really help.
Okay. Does anything aggravate the pain?
Wearing shoes, touching it, and walking generally make it worse.
Do you find that the pain stays localized, or does it radiate anywhere?
It's local. It doesn't radiate anywhere.
Okay. Do you find that is it worse in the mornings, at night, or is it just constant throughout the day?
It's constant.
Constant. Okay. On a scale of 1 to 10, if you can rate the pain, 10 being the worst pain you've ever felt, what would you say?
I give it about a 7.
A 7. Perfect. So now I'm going to get into some past medical history questions. Okay. So have you ever been hospitalized?
Yes, appendicitis when I was about 18.
Okay. Do you have any pre-existing illnesses, diabetes, hypertension, any childhood illnesses?
Nope.
Okay. Are you currently up to date with your immunizations?
Yep.
Perfect. Do you take any medications?
Just the Tylenol and multivitamins.
Are you allergic to anything?
No.
Are you feeling any emotional problems?
No, I feel pretty good.
Okay. And have you ever had any blood transfusions in the past?
No.
Okay. So you had mentioned before that you were hospitalized for appendicitis. Did you have a surgery with that?
Yeah, an appendectomy when I was 18.
Okay. And let's get on to your family history now. So for your mom or your dad, do you know if they have any history of diabetes, hypertension, heart disease?
My mom had hypertension and my dad has diabetes.
Okay, and as far as your grandparents, do you know any information about them?
Alive and well.
Alive and well, perfect. As far as your sleeping habits, how are you sleeping?
Good, about 8 to 10 hours.
Okay. Are you sexually active?
No.
Do you smoke any cigarettes?
No.
And what do you do for work?
I'm a construction worker.
Okay. Do you exercise regularly?
Just the on-job exercise, to be honest. Climbing ladders, hammering walls.
Okay. And do you have any pets?
No.
And what would you say your diet is like?
High protein, lots of vegetables, rice and beans.
Okay. Do you drink any alcohol?
Social, 1 to 2, probably every other weekend.
It's not bad. Okay. And do you do any illicit drug substances,
No.
marijuana, anything
No.
like that? Okay. Are you married, single, or divorced?
Single.
Okay. And have you recently traveled?
No.
Okay. Perfect. So now we're going to get into the physical exam. And we're going to start with the vascular exam. Okay. So the first thing I'm going to do is I'm going to check your pulses. So checking your dorsalis pedis pulse. And that's good, a 2 out of 4. And I'm checking your posterior tibial pulse now. It's good, 2 out of 4. Checking your popliteal now, 2 out of 4. And I'm checking your other popliteal, which is a 2 out of 4. Perfect. I'm going to check your capillary refill time now, okay? So I'm going to check for blanching of less than 3 seconds. So, good. Good. Okay. Okay. Next, I'm going to check your elasticity and skin turgor. So I'm just going to pull on your skin. I'm trying to hurt you here. And perfect rebound there. And good rebound there. I don't see any rubor or any sort of vascular issues, so everything seems to be within normal limits. Next thing I'm going to do is I'm going to check your temperature. Okay, so I'm just going to run my hands down I could see that everything is within normal limits, warm to warm, which is exactly what we want to have. Next, we're going to perform the derm portion of the exam. So the first thing I'm going to do is I'm going to run my hands down your legs, and I'm checking for any papular lesions, any macular lesions, patches, things that I can visibly see. And I'm going to check from underneath. I'm going to feel to see if I can feel the same thing. And it's good here. Next one. And that's fine. I'm going to check for hair growth, which is normal. I'm going to check for any interdigital macerations. Sorry about the toe, by the way. And that's fine. Everything seems fine here. The only thing that I can see, however, I can see a hyperkeratotic nail where the nail plate seems to be risen or elevated past the nail bed. You seem to have some pain to palpation, am I right?
Yes.
Some pain to palpation. It's erythematous, which is common. I mean, these things, if it is what I think it is, it could lead to some infections. I don't see any Zayas-Bazan. I don't see any other lesions or patches that we need to worry about. So the next thing that we're going to perform is going to be the neurological portion of the exam. And if I can just have you lean forward a little bit so that I can check your reflexes. So we're going to check your patellar reflex first, and what I'm going to do is I'm going to hit you right here. I'm not trying to cause you any pain or anything like that. So perfect. Perfect. And that's going to be so far so good. And we're going to check the Achilles tendon reflex now. I'm going to put my hand underneath. Good. Good. And this appears to be 2 out of 4. Seems good. Next, what we're going to do is we're going to check your vibratory sensation. Okay, and I'm going to need you to close your eyes, and you're going to tell me when you feel the vibration, when the vibration stops. Okay?
Okay. Started. Stopped.
Good.
Started. Stopped.
Good. Perfect. Next, we're going to check your sharp and dull sensation. So if you can just lean back for me. Perfect. Okay. So close your eyes.
Okay.
And tell me when you feel sharp or dull.
Okay.
Okay. So
Sharp.
okay.
Sharp.
Okay.
That's dull. That's dull. Sharp. Sharp.
Perfect. Next, we're going to check the Sims-Weinstein. And by the way, everything seems symmetrical and intact. There's no diminished sharp or dull sensitivities. Okay? And I'm going to have you close your eyes, and I'm going to ask you to tell me when you feel this, okay?
Okay. Yep. Yep. Yep.
Okay.
Yep. 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 Mm-hmm.
Okay.
Yes. 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 Yes.
Excellent. So your protective threshold is within normal limits, and I think that pretty much completes the... Oh, actually, there's one thing that we're going to do. Forgive me. Close your eyes one more time. We're going to do some proprioception.
Okay.
So just close your eyes and tell me if your toe is facing up or if it's facing down. Okay?
Okay.
So here we go.
Up. Down.
Perfect.
Up. Down.
Okay. I'm going to try your other toes because I don't want to hurt you there.
Down. Down.
Perfect. So proprioception seems adequate. Next, we're going to check the Babinski. And this is checking for upper motor neuron lesions. And I'm going to go ahead and go from medial to lateral. You should see fanning of the toes. Perfect. Next, we're going to check the musculoskeletal portion of the exam, and I'm just going to check your dorsiflexors, plantar flexors, your inverters and everters, okay?
Okay.
So go ahead and push up to me. Perfect. Push down. Okay. Push in. Good. Push out. Good. Last thing we're going to do is we're going to do the silver skyoid test, and we're going to try and put you in neutral position. So I'm going to align the second toe with the tibia here, okay? And then we're going to dorsiflex. We're looking for more than 10 degrees. That's perfect. Next, we're going to do the same thing. Align with the tibia, your second toe, okay? And we're going to dorsiflex. Perfect. That completes the physical portion of the exam, and what I'm going to do is I'm going to relay the information to Dr. Hill and see how we can get this toe fixed up. It seems to be, just from what I'm seeing, it could be a subungual exostosis. We would need to do some x-rays to confirm, and we'll discuss further treatment when Dr. Hill revises my notes, okay?
Perfect, thank you.
Thank you very much, appreciate that.
Thank you.